Hi, I'm Allison. I'm going to be going over my lower quarter screening exam. The first thing I would look at is posture. I want to assess the pelvic alignment. This can give me information on any muscle imbalances, if they're anteriorly or posteriorly rotated. This could tell me what's facilitated or potentially inhibited. The next thing I would go into is a lower quarter functional movement screening. I would do forward and backward bending as well as an axial rotation, single leg balance, squat, and a climber step up. Depending on how forward and backwards bending goes, I may do a Cyriax selective tension test. I may not do this depending if the patient doesn't respond well to the forward and backward bending, because adding overpressure as well as resistive testing could just really exacerbate their symptoms. Um, After that, I want to do a neuroscan such as myotomes that can give me an idea. I think that this is a herniated disc, and doing myotomes can help give me an idea of what nerve root level is being involved. I want to do dermatomes. I want to know if they have any sensational deficits. I could also do DTRs as well as Babinski and Clonus. Um, the last thing I would do is potentially do a slump exam. This I'm hesitant to do just because the patient is probably going to already be flared up and this could really exacerbate their symptoms. So I'm going to kind of play it out to see how they go. But I am expecting this patient to have some dural tension for sure. I'm expecting forward bending to be limited and painful. With backward bending, I'm not really expecting any abnormal findings. I think maybe he'll have pain relief, if anything, going into that extension. And my next video is going to be my demonstration.